And to tell you a little bit about Migraine and Headache Australia, some of you could probably say this for me now. You've heard me say it a few times, but it's really threefold. One is to provide trustworthy and reliable information, which is what tonight is all about, learning from a headache specialist and world-renowned expert with Professor Tissa Wijeratne. We also aim to fund research each year. In the last 11 years, we've funded 8 different research projects through an independent medical review board that examine submissions on a merit basis. And we also advocate and support for people living with migraine and headache disease. So what have we been up to? Well, this year, there's been a number of things we've been doing. Each night, I've taken one of these items and spoke about them in a little bit more detail. And tonight, we're going to be talking about the parliamentary inquiry. So Migraine Headache Australia was selected from one of hundreds of organizations as one of hundreds. And actually, there was a group of us that were presenting in the room at the day. A select few from the group that spoke about the process into new drug development approvals and research, as well as the pharmaceutical benefits scheme. And so we were talking about how the process is very challenging and difficult from the patient perspective, because we see these treatments come out. They come out in the US. They seem to be fabulous, successful treatments. And there's a big delay in them coming here. They get submitted for approvals. We don't see what happens in those submissions. There's a lot of redacted information, which means that it's blocked out or it's not available to the public. And then there's negotiations that go on behind closed doors between the manufacturer and the government to agree on a price or a proposal that will allow for PBS listing. And what we've seen with some of the more recent treatments that was spoken about last night is that it can take several years. So for people that have been given access to these treatments, to have to wait several years, or to be able to try this treatment, have a fantastic response, but then have the rug pulled from underneath of them because they're no longer able to get access to that treatment, they have to wait several years, is really difficult and extremely frustrating. And so that's something that we expressed in this inquiry alongside other patient organizations for this parliamentary inquiry into new medicines. So we hope that they've heard the message loud and clear, and we certainly represented the community voice in that aspect. So to talk about the webinar tonight, and who it's for. So if you have migraine or headache, if you're a parent or caregiver, if you'd just like to connect with others like yourself, or if you want to ask questions, then you're in the right place. And if you do want to ask questions, and tonight's your first night joining the live webinar, then you can do so by going to the bottom right-hand corner of the screen. And right now you'll probably see it says chat. You can click on that and it'll switch it over to Q&A, and then your text that you submit will appear as a question, and that will alert our moderator, Anik, who is also here in the chat for everyone, to make sure that we can submit those questions. Now, we do have a few hundred people attending, and so we will do our best to answer as many questions as possible. Now, to introduce Professor Tissa Wijeratne, he has more appellations after his name. He's a medical doctor, and he's involved in many different facets of neurology, medicine, migraine, and headache, not just in Australia, but around the world. And he's a prolific researcher. He's published over 200 papers to date. He's trained over 300 physicians, and he led the world first Brain Day campaign, which was part of the World Federation of Neurology and the International Headache Society collaboration on migraine, which was able to reach millions of people worldwide. So Professor Wijeratne is an extremely passionate, talented, and dedicated headache specialist, neurologist, and physician. So it's a real pleasure tonight to be able to introduce him and to have him present on this very interesting topic. So without further ado, I will hand it over to Professor Wijeratne.
Thank you very much, Carl, for that introduction. And it is a great honor and privilege to talk to fellow Australians during one of the most important weeks in headache care in Australia, the Headache and Migraine Awareness Week. And the topic that the organizers wanted me to talk is a topic that is very close to heart and very close to my heart, and I'm sure it is very close to you all, while the more than half of the country is still in the middle of a lockdown. So I'm going to tackle the topic COVID-19 and migraine, and almost all you need to know. If you want to know more, please book your free ticket to the upcoming 4th Lance Godsby International Neuroscience Symposium, where we would be talking about this as well as many other topics that are relevant to brain health. So my disclosures: COVID-19 and brain continue to fascinate many clinician scientists like us, like myself. While our group successfully completed the world's first PhD in COVID-19 and brain, it is important to remind you all that this is still an evolving story. All the comments that we make today are only valid for what we know today. Therefore, make your decisions with as much information as possible in conjunction or in consultation with your family doctor and your neurologist. These are some of the frequently asked questions by you all since the pandemic came on board. Many times, I myself have been asked by you all, from your perspective as a headache specialist, how has COVID-19 affected Australians living with migraine? Is it okay for me to have a vaccine? Which vaccine should I have? Is headache a common side effect of the vaccination? Does the vaccination trigger migraine attacks? This is same for other headache disorders also. Is this similar to cold or flu, triggering many people and experiencing when they fall ill, or is it something due to something else, such as ingredient in the vaccine, so on and so forth? Can I take my migraine medications? Can I have my botulinum toxin injections? Can I have my CGRP injections with the vaccine? For someone who catches COVID-19, what type of headache or other neurological symptoms can they experience? Can COVID-19 cause migraine? Can COVID-19 cause disabling new daily persistent headache or NDPH? What do we know about people with pre-existing migraine or headache disorder who then get COVID-19? Can this disorder still be treated if you have COVID-19? What do we know about the pathophysiological links? In other words, the disease mechanisms of COVID-19 and headaches. And long COVID, post-COVID-19 neurological syndrome, are they two different disorders? Are they the same? What do we know about these disorders? Do we know people are more likely to have problems or delayed recovering from COVID-19? What's the role of inflammation? How do you manage these? Are there any changes that we should make as humans to our routine habits of treatment as a result of COVID-19? What advice would I give to people with migraine or other headache disorder in Australia in light of COVID-19? As you can see, these questions can't be covered within a half an hour gig, but I'll try my best. When I Google the current COVID status, this is what came out from various websites, including Johns Hopkins site and World Health Organization. As you can see, we have well over 225 million the people suffering from or having got COVID-19, with nearly 5 million lost their lives as a result of that, leaving just over 200 million living with this condition. You can double these numbers, so that's probably the real number. When you come to Australia, it is probably well over 100,000, because this is what we detected, but there are a whole lot of other undetected cases also, which means there is a large number of the human beings that are living with the aftermath of this problem. So this is going to be the biggest thing that we would be dealing with for a long period of time to come. So to tackle these problems, we have been working the day and out since the pandemic began to hit us. We published the first Australian case of COVID-19 patient that we studied as Hawks. He was with us for about 4 months. And I used to tell most of my colleagues, although I have been medical folk for well over 2 decades, I learned most of my medicine best during the pandemic from patients like this gentleman. So this patient taught us many things. Here I am showing you the very simple white cell count graph that we plotted on him, that we published in different platforms on peer-reviewed journals. You can access them through PubMed. The important thing is, for the first time, we learn that every peak in these immune cell graphs were related to a neurological impact or neurological effect that he had during his stay with us well over 4 months. We then went on to extrapolate a new index that is telling us how the background immune status of this particular gentleman was teaching us probably a few hours before he was hitting with a neurological problem. We called it as serial systemic immune inflammation indices. As you can see, when we plotted the calculating very simple blood tests, which are universally available to anybody, we were able to correlate each peak with neurological symptoms that he was impacting, including headaches. We then realized that there is remarkable similarity between how human brains react to a viral infection like SARS coronavirus 2 or COVID-19 and stroke. As you know, we get stroke due to blockage of blood supply to a part of the brain or bleeding into the brain. COVID-19 we get due to viral infection. But the way that we as a bunch of animals or human beings react to these two things appear to be the same when it comes to how we get sick or how a particular disease mechanism occurs. We published an in-depth the review paper, which I rewrote almost 100 times before we submitted it to this journal. As you can see, last time when I downloaded a copy of that, it had been seen by close to 7,000 fellow scientists, which is a testimony to what we said was reasonably well accepted globally. The reason for this is this. On the right-hand side of this cartoon, don't worry about the complexity of the picture. What we try to show is when we get COVID-19 infection into the lungs through the respiratory system, whatever that is happening in simple the blood vessels or tubes in the lungs, and then the defense mechanisms that we have, just like we have Australian Army, Air Force, police protecting us, we have similar protective forces around our body and inside our body, the protecting us from these exogenous pathogens or bugs, if you like. When COVID-19 bug hits, these the battalions would start to play together, and just like our defense personnel use a variety of armamentarium, they have their own tanks, they have their own chemical weapons to attack the bug that is coming into our body, in this case SARS coronavirus 2. And then some of the byproducts that they produce as a result of this war between foreign invasion and protective forces, there are other chemicals that get released in the lung area or gut area, for that matter, wherever the entry site occurred. And then we realize that when these chemicals release into the bloodstream, it doesn't take long for that to get to the brain. Say, for an example, today, when you are walking your dog along the street, if you hit your big toe on a rock, the first impact that you have is pain. You don't feel your pain actually in your toe. It's actually happening inside your brain. Your brain basically tells you that there was a problem in your big toe. So in other words, when you hit your big toe on the rock, some of these chemicals started to release in your brain, basically telling you to be focused and take your big toe away. Similarly, when the SARS coronavirus 2 enter into the lungs, when these defense mechanisms inside the lungs start fighting the virus, some of the chemicals that get released automatically get released in the brain, and then the brain blood vessels started to behave in a variety of ways, causing similar impact. Then the defense mechanisms in the brain, although there may not be a bug inside the brain, because the memory and bug-related activities are happening in the brain, there are other cascade of events that are happening in the brain. We showed to the world for the first time that the same mechanism happens when you have a stroke or any other brain disorder for that matter. So the inflammation is playing a critically important role in all these disorders, contributing to most of the symptoms that our patients experience and most of the symptoms that we observe in our patients. So far, I'm talking about COVID-19 involvement of the brain and drawing the similarities between acute stroke and post-stroke symptoms that most patients are experiencing, and COVID-19 patients could potentially be experiencing also. Now I'm going to shift the gear to answer some of your other questions. What's the relationship between COVID-19 and migraine? In my own book, I have just over 1,000 migraine patients that I manage regularly, and more than 50% of those patients reported to me that they have had exacerbation of headaches since the pandemic came on board. The fact that they couldn't access me easily probably didn't help them either. The fact that we couldn't start their regular treatment, such as botulinum toxin injections, in a timely manner due to multiple lockdowns and other things, probably didn't help them either. Similarly, many migraine patients reported to us that since they had vaccinations, irrespective of the type of the vaccine, many of them they got headaches also. I'll come to that in a moment. But here I'm going to share with you Dr. Shapiro, Professor Shapiro from the Burlington, Vermont, did a very nice meta-analysis and systematic review in collaboration with the Italian colleagues, showing to us, trying to understand the COVID-19 and migraine relationship. They basically they ended up scanning through well over 3,000 research papers published by fellow researchers globally, and then they selected 48 of those research papers, giving them marks on accepted metrics by other experts, thinking that they were the best quality research studies that were concluded in meta-analysis. This is how you create the best evidence in medicine. So this is as best as one thing can get. So essentially what they found is there was 1 in 10 patients who had COVID-19 reported headaches. That's 10%. To put it in this way, if we had 10,000 patients with COVID-19, at least 1,000 of them would experience significant headaches as part of that. You may probably know that I run the neurology department in the hospital, which was hardest hit in COVID-19 even to date. There was a time that we had well over 150 patients every day coming in with COVID-19. Indeed, this is what we have seen on them also. And the other important thing that I got out of this research paper is, interestingly, those patients who had headaches, in other words, that 10.4% of those patients who reported headaches as part of their COVID-19 illness had 2% or the 2 times higher relative risk of survival. In other words, having a headache seems to be a protective prognostic indicator of survival with COVID-19. In other words, to put simply, if you had headache as part of your COVID-19, your chance of surviving COVID-19 and not dying is 2 times higher, which is interesting to contemplate. And the next question that I'm trying to answer is, what is the link between migraine and COVID-19? I already told you that almost half of my patients had more migraines around COVID-19 the time interval. So again, the Dr. Shapiro's group did some excellent work by looking at a cross-section of United States America adults using their National Health and Wellness Survey. From memory, the up to sort of July last year, the over sort of a 2 months period, they plotted those people who had COVID-19 and those people who had migraine, those people who had COVID-19 and migraine, and those people who had the COVID-19 but no migraine. They also looked at flu vaccine status at that time. Remember, by July last year, we didn't have a whole lot of COVID vaccines around to us. The reason that they selected flu vaccine is, at least at that time of the pandemic, we felt that having flu vaccine status is somewhat protective to get COVID-19. So they had almost 70,000 total responders out of this wellness survey. Around them, among them, close to 8,000 had migraine, and 58,000 had no migraine. As you can see, the percent total cohort in this cohort is about 12%, and mean age 42 years of age. Naturally, majority of these patients with migraine were women, as we all know that migraine is more common in women than men. It is worth noting that well over 1,000 patients self-reported that they had COVID-19, non-vaccinated. Here, the non-vaccinated means they didn't have flu vaccine. I'm not talking about COVID-19 vaccine. When they did this study, we did not have a COVID-19 vaccine around freely globally. And the only 360 of them had a positive COVID test. Whichever the way that you look at it, the percentage of migraine that had COVID-19 was 50 to 60% higher compared to those people who had COVID-19 without migraine. In other words, when you had migraine, it seems to me that you had 50 to 60% higher chance of acquiring COVID-19. But the important thing to take from this study is, despite migraine made you more prone to have COVID-19, it almost looks like that migraine was a protective factor for COVID-19, as their COVID-19 illness lasted less than a week, and they were less likely to develop serious illness, and they were less likely to seek extra resources also. What does that mean? Does that mean that those of us who have migraine are the more able to fight these viruses than others? Potentially. I myself suffer from migraine. I suspect, although this is not a scientific statement, that maybe migraine is a condition that is making us a little bit more robust, if you like, to fight these things. I don't want you to take your masks away and walk like heroes tomorrow by doing that. As you can see, despite I'm in the office, I'm wearing my scrubs and not my usual tie and jacket. And when I go out, I would be wearing an N95 mask because I'm in the hospital. So listen to your public health experts. Don't try to be a hero. What do I think? I think as I published in Neuroepidemiology 2018 as an abstract at the World Brain Day Summit in Auckland at that time, the immunology, in particular psychoneuroimmunology, I'll demystify this term. Psychoneuroimmunology means when we are under stress, how our pituitary gland and how our stress hormones prepare us to fight or flight has a direct link to how our amazing brains and how we manipulate those defense mechanisms in immune system that I alluded to before, the working like an orchestra, if you like. I think this system play a key role in migraine. Obviously, there's a lot more work need to do in this space, as not much happening in this space globally. And Australia must step up the game. Despite we had less than 0.007% of total allocation went into headache and migraine, from 2007 to 2017 NHMRC, which I published in Neuroepidemiology when I did that plenary presentation at World Brain Day Summit, which was attended by Lancet Neurology Edit and a couple of other global experts, pre-COVID, of course. So be part of this, and you are key part of how you navigate Australian researchers, promoting them and pushing them to be interested in these areas and working hard so that we can put Australia back on the track among headache experts in the world, which we are not at the moment, unfortunately. So what do I think personally? I think the headache is definitely one of the key symptoms of this enigmatic, complex, yet absolutely fascinating brain disorder, migraine. And migraine, as I said before, this is my personal view, is probably an adaptive, robust response to viral infections and stressors that we all face day in and day out, which is much more elaborate now, given that we are being pushed from all corners by this pandemic. I mean, since this pandemic hit home, I couldn't manage to get decent sleep any more than 5 hours for the almost last 2 years. And that's not a nice feeling. But hopefully my migraine genes is helping me to fight this better. And tackle the changing the tactics again, what's in a name, long COVID versus post-COVID-19 neurological syndrome. It's interesting that long COVID is the first illness in the world that patients actually put this name to this. This was basically created by social media when young blokes and young girls in Europe created a whole lot of social media posts. They had COVID-19, they didn't go to a hospital, but almost 70% of them were experiencing long-lasting symptoms, brain fog, the tiredness, washed out feeling, headaches, dizziness, as migraine patients that we are all very familiar with. And the impression is that what we described as post-COVID-19 neurological syndrome, which is cited by well over 50 people already, 50 scientists already, are basically the same. I think there is a lot more work need to do to unentangle the mysteries behind them. We believe that this is caused by maladapted immune response with maladapted immune inflammatory indices, as we published with our first case of post-COVID-19 neurological syndrome early this year. Another question that you all ask is, can COVID-19 cause a new daily persistent headache? Personally, new daily persistent headache need a lot more work. It just, as the name says, you just out of nowhere get a headache on a particular day, particular time, and then it doesn't go away. Hence the name new daily persistent headache. There are a couple of case reports in the literature, including the Fedor Donos, the publication that I have selected here to show you that there are isolated case reports where COVID-19 ended up with new daily persistent headache-like illness, but the jury is out. We just need to keep our eye and ears open and study these disorders as hoax. You can see why I have been sleeping less since the COVID-19 pandemic hit home. So trying to go back to some of these questions, I think the COVID-19 has literally rewrote how we behave as human beings, how we behave as physicians, how we behave as patients, certainly how we should behave as Australians. I personally believe that this is an opportunity for us to go back to the drawing board and working together to protect brain health as best as possible and find solutions with a lot of synergy to unentangle these mysteries. So it has certainly affected significantly negatively, but we can turn this into a positive impact, which is what we have done over last the 18 months or so by donating the first PhD in COVID-19 and brain to the world, as well as unentangling a whole lot of mysteries and asking a whole lot of questions. I think it is important for us to keep asking questions so that we can get others interested in answering questions. Is it okay for me to have a vaccine? Of course. I think any vaccine that you can get hold of today is better than anything else. What vaccines does is it basically stops you from dying or getting admitted to an intensive care unit or getting admitted to a hospital almost 98 times less than otherwise. Some of you may know that I come from rural Sri Lanka, and many of my Sri Lankan extended relatives who had access to either Sputnik vaccine or Sinovac vaccine, that's what they got. Those people who had vaccine, although they had a Delta variant of COVID-19 hitting them, they didn't go to a hospital, they didn't go to an intensive care unit, they didn't die. At least those people that I know of. And similar reports are coming from all over the world. And headache is a common side effect of the vaccination. I myself had the 2 bouts of headaches. They were very similar to migraine headaches. I had Pfizer vaccine. First headaches lasted for about 6 days. Second slot lasted for about 6-7 days also. And then they disappeared. The other question, I think it is very similar to other infections, but whether there is something else, I think only time would tell us. My hunch is probably the inflammatory response that we generate as a result of vaccine. It may be that having a headache after the vaccine may be a good thing. Specifically looking at those Shapiro papers that I quoted during the presentation. However, there's a very rare side effect of the blood clots in the brain, but that's extremely rare. It's rare like hen's teeth. So that headache is a bit different to the headache that I'm talking here. You can, of course, take CGRP medications or other migraine medications despite you get the vaccine. There is a relationship between slight reduction of CGRP in the context of COVID-19, but that doesn't seem to have translated to anything sinister or anything significant. So the bottom line is you can have migraine medications irrespective of the vaccine. I think the most of the questions on this slide I have addressed in the middle of the presentation. While the jury is still out for us to unentangle some of these relationships, but the only way that we are doing that is you supporting our research projects, and we keep asking questions, and then we communicating with each others in a synergistic way. I think the long COVID PCNS, I addressed this question before, they are the same. I think the ongoing management is basically practicing healthy living, the tips, the protecting your sleep hygiene, sleeping much better than what I'm doing right now, and the not sleeping too much, but not sleeping too little, and eating healthy meals, being the nicest human being that you could be, going for a short walk, and basically listening to your public health experts, and then getting the vaccine as soon as you can access them, as it is one of the best arms that we have against this COVID-19. I am an eternal optimistic. I think despite the crisis that we're in, despite that we are in the middle of this lockdown, more than half of Australia, despite the COVID-19 has taken almost everything that we used to do, or almost everything that we took for granted away from us. This is an opportunity for us to rewrite how we do things and put things together, and then promoting better brain health, and hopefully fixing the mess that Australia in with regard to headache and migraine in particular, by doing much needed cutting edge research and joining you by planning and delivering those things to make migraine something in the past and make COVID-19 something in the past also. You have a wonderful opportunity to join us with a large number of global leaders, all virtual, all free, and we would discuss many of these things in this event also. Thank you so much for your patience listening and supporting Headache Awareness Week. And this is a key issue, and just get onto the bandwagon and support the Headache Registry also. Take care, stay well, and be nice to each others. Be kind, be compassionate, and look after each others. Thank you.
All right. Thank you very much for that presentation, Professor Wijeratne. That was fantastic. You certainly answered a lot of questions that I had during that presentation, and we certainly got a lot of questions from the audience as well. So we'll kick off now with some questions, and we'll start with one from Sarah, who wanted to know what's the best way you can prepare yourself just in case you are like you feel like you might have headache symptoms that come with the vaccine.
I think the what I normally tell my patients is that you pre-medicate with some non-steroidal anti-inflammatory medications or the actually probably paracetamol. Take 2 tablets of paracetamol before you go and have the jab and get the jab. Make sure that you have had a pretty decent sleep the night before. Hydrate yourself well. All sort of healthy things that you and me should be doing. Do them. And I certainly did pre-medicate myself with 2 tablets of paracetamol before I had the vaccine on the first time. And then when I was working on that day, and after about 6 hours later, I can't exactly remember, maybe 4.5, 5, I took another 2 tablets of paracetamol. There are 2 days that I normally go prolonged fasting most weeks, and I certainly made sure that that was not one of those days. And I didn't take on any major decision making or major things despite being the chair of the department for the next couple of days. So taking things easy, the making sure that you prepare your body as best as you can. And I think if you are someone who is getting frequent headaches, I think it is fair for you to take something pre-jab. Probably something simple like 2 tablets of paracetamol that might help. Although this is not a scientific statement, what I'm hearing from patients is this. Some vaccines, mRNA vaccines in particular, seems to cause more headaches during the second dose rather than first dose. The non-mRNA vaccines seems to cause more headaches during the first jab. Again, I have had a number of patients who had nothing wrong with them, and some felt magically better after the vaccine also, which I saw some of the comments on the Q&A section also. We are all very different from each other. Our headaches are different, the way that we respond to things different. That's why we are seeing and hearing such an entity. Hope I answered that question.
One of the things I was told is to make sure you get really good hydration, like the day before, the day during, and the day after. Does that help as well?
Absolutely. Absolutely. So it is very important that you hydrate well. I think even if you don't have the vaccine, most my patients know that I strictly advise them, unless they have specific advice from their family physician or other specialists, the minimum fluid intake that they should have is 3 liters. That's about 15 mugs of water per day, unless you have a medical reason to not to do so.
Okay. So we had 4 people, Emily, Kay, Kath, and Heather, all say that they have experienced or have heard of others getting worse or experiencing worse migraine or worse headache after COVID vaccination. Is that something that is a coincidence, or could it be due to the vaccination itself? Is it permanent? Is it temporary? Do you have any thoughts about
that? It's not uncommon. As I said, I certainly had a lot more headaches after each dose of my vaccination. I was one of the earliest folks to vaccinate, but I was basically the determined to get whatever the jab they were going to throwing at me at the earliest that I could get in. So when I walked in, I had no premeditation, so I was going to get whatever that they were offering at that time. I prepared myself well, hydrated well, and had some paracetamol also. Despite that, I had relentless headaches. But then they settled down after about 5-6 days, and story was back to base. So to those 4 people, I think again, it's individual variation. I don't think that it is going to be a permanent thing. I doubt it. We have unraveled some amazing mysteries around migraine during last couple of months, which I can't talk as we haven't published them as this is going to be an open space. So watch the space. Maybe for the next year headache, the seminar, we would have new stories to share with them. And even with that, what I'm seeing or what we are witnessing is it is probably less likely to be a permanent thing. Put it in this way. We are in the middle of a pandemic and virus is going crazy. And the only solution that we have to get out of this mess is vaccination. So we have to vaccinate in all corners. And that is the only way out. The other option is to getting infected with COVID-19. That's a much worse risk. Most of us are going to get infected whether we like it or not. Remember, vaccination is not going to stop us from getting COVID. What we are trying to do with all these lockdowns and rest of the other things, the reason that most of our patients can't get to see us face to face is not that we hate you or anything like that. We are trying to derail the virus spread until we get a larger proportion of community vaccinated. So the vaccination is allowing our immune system to get a measured response than real virus. Those 4 people who said that they had more headaches, say for an example, my own case, I was glad that I had the vaccination, despite I had more headaches after each vaccine than the other way around. The other option is to getting the real virus, and that would have probably knocked me out completely for months or would have even killed me. And vaccination basically reduces your chance of death almost 98%, 99%, and it reduces the severity of illness similar percentage also. So it's a very good armamentarium that we have. And all of us, also I saw that we had sort of like 450 mark hitting at the webinar when I was looking at the chat as I was talking. And if all 450 of us who joined today, and you, me, and our host, if we start brainwashing fellow Australians that with a whole lot of kindness and love and compassion, that it is much better to have the vaccine rather than going ahead and supporting protesters, we would come out of this much earlier and sooner than better. So it seems to cause an inflammatory reaction. It seems to exacerbate headaches on certain group of people. I can't basically give all the nitty-gritty data as we don't have them at hand, but I have, as I said, half of my patients told me that they had more headaches than ever. Some say that they were different to migraine. Some say they were very similar to migraine. We were doing few things with them, and again, I will share them in time to come once we get the publications out. I'm hopeful that this is not going to be a permanent thing. It is a much better, safer option to have the vaccination rather than the other. It is almost impossible or unlikely that vaccine is going to ruin your migraine for worse to last longer. Even if it is going to do that, always remember that the real virus is going to cause more havoc and more damage than the controlled introduction of memory of the virus, which is what vaccinations are doing.
So I get the sense that a lot of people do want to get fully vaccinated, but there's a little bit of reluctance and sometimes anxiety. And Josephine said that she has a lot of anxiety regarding COVID and the vaccines because she suffers from frequent migraine attacks. But then if she has symptoms from the vaccine, how does she know if that's just the normal migraine attack or if it's something worse like a blood clot or a heart attack that's, we know that it is extremely rare, but how do you not worry about something like that?
I think this blood clot business with regard to vaccination is largely blown out of proportion thanks to the way that media handled it. I'll put this to rest by giving you the facts. Way before COVID-19 vaccination came on board, this blood clot story, we were intensely interested in it. We were studying it, and we were a group of several local and global the groups, if you like. What we knew before COVID-19 is this peculiar type of blood clots. For the audience, I'll explain it. There are two types of tubes in our body. If you raise your hand up, if you can see my hand, you can see bluish blood vessels close to my hand here. These are known as veins. If I put my hand here and feel my pulse on my radial artery, I can't see a tube, but I can feel the pulsation of my radial artery. That's an artery. So that's the artery which is deeper and veins more superficial. So the brain also has these two types of blood vessels. Veins basically take unpurified blood away from the brain to the lungs and then to the heart, and arteries supply blood to the brain so that we can do all the things that our brains can do. So this particular blood clot that we are talking about, brain, is blood clots in the venous system. This is fancy name for this is cerebral venous sinus thrombosis, or CVST. So this is not any clots. This is blood clots in the venous system, or the blue tubes in the brain. And they are very unique and very rare, like 1 in 100,000. And for the last 100 years, every sort of a couple of years, we would add a course for this than knowing everything about it. With COVID-19 vaccine and COVID-19 itself, we added another course. And it didn't go anything more than what we have seen before. The incidence of them were 1 in 100,000 before. They were largely affecting young women. And COVID-19 pandemic, I was basically browsed through every single case published with COVID-19 virus. It is still remaining in the same realm, same number. And vaccination, despite the huge ha-hoo that media has created, unfortunately and sadly, still the numbers are the same. So that's the first fear to get out. So it's rare like hen's teeth. But if you do get a headache with CVST, if you worry about that, go and see your doctor. And the sorting this out is very easy. We have in Australia, we are very lucky. We have all the available technology in almost every city in the country with ready access to those scans. I don't think they are necessary for every headache, but where it is necessary, that can be done. Of course, you have read about deaths that were reported on this also in media, right? But we have seen that with non-COVID venous sinus thrombosis also. I myself normally see about 10 to 15 cases like this, and some I lose, unfortunately. That's the nature of the beast. So to summarize that, having a hesitancy and being anxious about vaccination and not having vaccination is heaps more dangerous and going to generate more anxiety and more harm to you than having a good, decent discussion with your GP or your specialist and going ahead and getting the vaccine. This virus is spreading at a super fast rate. It has basically stopped many things. I mean, everyone knows this. You don't want me to tell that. And the vaccination is one of the exceptionally good weapon that we have this phase of the pandemic compared to last year where we were today. And it is something that we must have. And I am an ardent supporter and advocate for vaccination. Those of you who follow me on Twitter have seen that I had some threats about this also, but the facts are facts. Science and education is the only way to get out of this, and vaccination is one of the very good armamentariums that we have at the moment. And I can categorically reject all the other rubbish information that is out there saying that it is going to cause this, that, and the other. I know that there were a lot of questions about aneurysms, the various types of migraine and this and that, asking me whether they are contraindication for vaccine. Absolute no. Absolute no. Even if you had blood clots in the brain in the venous sinuses, you could still have different types of vaccines that have much less risk than the usual blood clots that you get without vaccine. To put this into another perspective, this blood clot business, if you look at the risks of someone dying from COVID-19 vaccine and blood clots in the venous system versus someone coming to your home and stabbing you to death versus you having the lightning strike and dying. I mean, I wouldn't talk about the earthquake. I didn't think that earthquakes were a thing in Melbourne. I was trained in Christchurch for several years. We were very used to this, so I wouldn't get that example. But you dying from any one of those things is heaps more higher than you dying from COVID-19 vaccine. So
okay,
it's a very rare thing.
All right. And I know we've got a couple more questions and we're running out of time. So I'll give you a quick question from Peggy. Is it okay to get vaccinated if I'm having a migraine on that same day?
Absolutely. Absolutely. I would, again, you treat your migraine as it is. I have had my patients who had CGRP antagonist injection and COVID vaccine on the same day. I don't have
Okay.
any limitation of any one of those things.
So that brings us to our next question from Dan. Does it affect the efficacy of a CGRP antibody or Botox treatment, for example?
Absolutely not.
Okay. And does it, Patricia wanted to know if the resilience seen from people that have migraine, that sort of protective factor that might be conferred from migraine as a result of being exposed to COVID, might that be due to the medications we're taking, or do you think that's something more intrinsically biological that we, as people that have migraine, have?
That's a $50,000 worth question that I can't answer. I would like to think that having spent almost 30 years supporting migraine and migraine-related work, that some credit should come to medications, but we don't know the answer. I think I think the honest answer is I simply don't know. This is just a signal that we have seen. I think what it reminds us is how absolutely fascinating this disorder and how critically important for us to convince doctors like me in Australia to come on board and start researching and change that really depressing number of 0.007 going into the biggest cause of disability in Australia is a crime in my mind. But we are part of that. I put my first migraine grant after sort of 10 years only this year. And I am also the culprit of this, but I am changing the thing at least. But I want you to convince your doctors that if you are a physician, you must be interested in research. You must be interested in some public work. You must be interested in some academic work and work together as a network and change this number. I would like to come back to this podium one day and say that now we get 15% or at least 2% of NHMRC money going to migraine-related research. We are one of the first world countries. We are one of the luckiest countries in the world. We are the country which produced Professor James Lance and Professor Peter Goldsmith to the world. They are probably the best headache experts that this world had ever seen. And how come we spend less than 0.07% of money going to support other researchers? So to answer Peggy's question, I think we desperately need this research. And I wish a day has more than 24 hours so that I can even sleep much less and spend more time on this. Hopefully we would know more, Peggy. Great question.
So we've had a couple of people in the audience actually say that their migraine condition has improved since their vaccination, but they did experience headache, but it wasn't migraine. And Brooke was one person who said that she felt a huge surge of energy that went for 9 weeks and she didn't have a single attack. And didn't even have a prodrome, and said it was almost like a miracle. She wanted to go back and have monthly shots of the vaccine. Have you heard stories about the other side of that, and have people having good results?
Absolutely. I think what it shows is I alluded to this during the last part of my talk. Again, this is not a scientific statement. Many other headache experts probably laugh at me, but that's okay. People laugh at Galileo when he said that the world is round and they were trying to kill him also. I think the migraine has a significant the psychoneuroimmunological component and maladapted immune system driving most of the symptoms or some of the symptoms. And if you had a vaccination and the immune reaction that you develop is a positive one, mobilizing certain immune cells and mobilizing that psychoneuroimmunological pathway for better, surely you should get better. At the moment, all the treatment that we have at the moment is not targeting this aspect of the migraine at all. Although you could argue that CGRP is a molecule in some immune pathway, so it may be targeting some. I think it is exciting time to be in headache world, and the next 5 to 10 years would unravel more mysteries. I have heard that before. I think it is real. I think that potentially the explanation, again, not a scientific statement, it's my hypothesis and my opinion, is probably positive psychoneuroimmunological impact. Can we harness that more? I think we absolutely can, and we just need both parties to get involved. The way that we do research these days is you are equally important as we are. So we are in this together. So both patients and clinician scientists should work the work, the hand in hand. We would always come with pie in the sky, but you are the one who are filling up surveys and giving away blood and rest of the other things. So you should be party to the way that we plan things. That's how we can get these things done properly.
Well, I think that's an excellent place to wrap up. I know there's more questions. We are out of time. I want to thank Professor Wijeratne for joining us tonight for that excellent presentation. There was some information there that I'd never heard of about COVID and the vaccine and migraine and headache. And I know that a lot of people will feel a little bit less anxious about getting their vaccine and moving towards herd immunity. Thank you very much for everyone joining. Thank you to our moderator, Anik, who's been working in the background. And we'll see you all tomorrow for day 4. We have a patient panel, which is led by ABC reporter Stephanie Dazelle, which should be a wonderful case study and hearing about other people living with migraine and headache disorders. And we have other types of headache disorders in the patients that will be joining tomorrow night. So we look forward to seeing you then. But for now, thank you and good night.
Thank you. Stay well and safe. Be kind to each other and be nice to each other. Take care.